You talked about making connections. What did you learn about? I saw a ton of articles. I shared some stuff that you guys were in around vulnerable populations and people who want to get it, who couldn't and couldn't get there to you. What did you learn about them and their situation, but the connections it took to make to serve those guys?
Yeah, I mean, to be honest, it was probably like one of the most rewarding, like professional rewarding things I've ever done, like ever.
Yeah.
And I think one thing that was really refreshing to see was just how appreciative people were. And so, I mean, you know, I'm sure a lot of people have stories about people calling or emailing and saying, well, you know, I don't know why my neighbor got, you know, my shot from, you know, Pioneer Pharmacy and they're not as deserving as I am. And you just saw a lot of, I call it like immunization entitlement. And when we went, I mean, we immunized. So there's IDD group home providers. And so these are wardens of the state. They have, you know, major seizure disorders, severe autism, Down syndrome, and a lot of times they're living in group homes that are state funded. And they were supposed to be taken care of by the federal program, by those three big chains, right? And it almost felt like, you know, the speech on the battleship. Hey guys, mission accomplished. We're out. And then all of these, you know, IDD group home providers were saying, hey, we've got 20,000 patients that, you know, I tried calling, you know, these chains to set up appointments and they stopped returning my calls. You know, I'm in Eagle Pass, Texas. Yeah, we had a group home provider say, you know, the big chain took care of my Austin location, my Dallas location, my San Antonio location. I called them asking about Laredo, which is, you know, by the border. I called about Eagle Pass, which is a small town that has less than 1,000 people. I started calling about, you know, Victoria and Goliad, Texas. And then all of a sudden those calls stopped rolling in, right? And so I thought it was very interesting. And I'll probably have my perspective forever changed about a lot of times when we make things, we think about, you know, the 85 to 90% of the population that it covers, right? Even the state created this online documentation portal that we had to record all of our vaccines through. And they told us, all right, guys, so when the patient walks up, you're going to ask them these 13 questions, which were like, are you allergic to polysorbate? Are you allergic to polyethylene glycol? You know, have you used dermal fillers?
Right. I'm literally the person, like, I'm literally got my hands up like, I don't know.
Right. Like, and I was like, I know. And they were like, yeah, so when the patient walks up to you, you're going to do that on site. And I was like, these patients don't know their middle name.
Yeah. Are
you expecting them to say, oh yeah, that's right, I traveled to Italy last week? Like, it just doesn't make any sense. And then even what I found too is it was just so crazy. I just realized how many people were overlooked. So not only the IDD population for, you know, intellectual disabilities, but then also we got a call from the state health department saying, hey, the Texas School for the Deaf and Blind have been having a really hard time getting vaccines. Number one, right? Think about it, if you're someone in the deaf community, you can't call your local pharmacy and ask if they have a vaccine.
Right.
And even if you show up to their store, what I found is a lot of deaf folks are ESL, so English as second language, with their first language being, you know, sign language. So even if you show up, how do you fill out a questionnaire paper form when you can't even read English? All you can do is sign. And so it was funny because the state thought it was only like, you know, 80 you know, blind and deaf folks that needed the shot. And then when I talked to the School for the Deaf, they were like, well, we have, you know, probably 1,200 people in the deaf community and students and staff that need it. And then the School for the Blind, they had about 100. And so we gave 1,600 shots to people at the School for the Deaf. And we had like interpreters, translators, alumni from all over. Like, I mean, we had someone that graduated from the School for the Deaf in the 70s drive to this event because they didn't have anyone that knew sign language in their hometown. And it was crazy. And it just made me realize that there's so many people that we need to think more about, that either the government, you know, healthcare, insurance companies are completely forgetting about, you know?
Well, I mean, I was looking through the pictures that you shared with us before this, and it's like, it's nuts, right? You see you guys all over the place, and every time you had your masks off, you guys looked super happy.
Yeah.
Right.
I mean, it was awesome. I mean, to be honest, like, I mean, they were hard. I mean, for those that haven't seen the pictures, we just loaded up 4 12-passenger vans, loaded up our equipment, and had teams of 7 to 8. And one of my pharmacists, I had lead each team, and they did an awesome job. But it was waking up at 5:30 in the morning, driving to the state health department, picking up doses, driving to the site, setting up our tents. Like, it was a lot, but I mean, it was awesome because when you saw we also took care of the foster care kind of department too, with all the foster care families. And like, I mean, families saying that, you know, my son has Down syndrome and I haven't gone to a restaurant in a year. He hasn't left the house because he doesn't know to keep a mask on. How do you explain to someone with Down syndrome during a pandemic, right? And so it was just super rewarding. And then, you know, it kind of a turn. I get this nasty email from a patient yesterday saying, you know, why haven't you sent me an appointment? Like I got my appointment somewhere else and I want to get it closer. And I was like, ugh. So kind of,
you're like, dude, yeah,
I know. And I was like, literally, like someone just drove their like, you know, special needs son, like, you know, 45 minutes to go get taken care of, or, you know, a deaf community member drove an hour to get their shot because, you know, and they were super grateful. And so it was really hard kind of like coming back to the private sector in the sense that, I mean, we're all customer focused, you know, 100%, like we know our patients have high expectations and we're going to meet them, but it was just nice to be appreciated for a bit.